amrilaris yang termasuk
contoh kebijakan di nasional juga kan kita belum ada itu. Jadi mereka yang maunya apa gitu kan sama orang tua juga ya punya perspektif berarti kualitas.
Kemudian ini apa sih? Oh yang tesis atau enggak tesis sama yang bagus
kayaknya begitu tuh barang barang ya sebenarnya rasa nasal stage and chronic sinusitis apa yo kan dengan apa jenis cara-caranya measure stage terus moment stage itu kan dengan ada objektifnya di sini
You want only to see ladies. You want only to see the pattern.
I also want to see how they interact with each other. The title and the objective doesn't match to each other.
So, when I try to understand, you will have some patients with a nasopharyngeal carcinoma sites, and just say how many they are, and how many patients you find that. Is that what I understand?
There are more than components, included cell and also the cytokines.
You should just want to show how many of these are present.
Not only how many, but can we titrate them? Can we compare between normal and NPC tissue? Because I'm talking about pathogenesis.
You are going to compare them with normal tissue?
Yes.
That's not in your target.
No, but I hope I can include them as in one as pathogenesis.
And it should be in your title.
Okay.
Your title is not. In your title, I should see that you want the carcinogenesis. That's very, very, very ambitious. So stick first to one object and try to make your title that I understand immediately what you want that you are going to compare. You are going to make the other people. Don't put it like this. Put it on different sides. Yeah?
Thank you.
You're welcome. Dimas. Speak loudly, even if you are not convinced that this is okay.
Okay. So my research is correlation of hormonal contraception exposure with progesterone and estrogen receptor messenger RNA expression in orbitocranial and angioma patient. Sorry for the time.
Let's try to understand it. It's nice to see correlation, contraception.
Correlation of hormonal contraception with progesterone and estrogen receptor messenger RNA expression on meningioma tissue using real-time PCR.
And of course, the title is very consistent to the objective. That's not difficult. Why is this important?
The factor contributed to meningioma. If I can note it, like for instance, if the exposure of hormonal contraception is longer, and it is correlated positively with the expression of the messenger RNA, so maybe we can conclude that the hormonal contraception is have contribution to meningioma.
It's not that the exposure will create receptors.
Yeah. We want so first we want to see the correlation from
Correlation. Correlation can be causal or can be accidental. Yeah. Do you say that exposure to hormones will promote receptor? Think of it. Because that's crucial in this. And then thesis, that's
The safety and efficacy of FK-CXL, photoactivated chromophore for infectious keratitis cross-linking as an adjunctive treatment on infectious keratitis. safety and efficacy of FK-KMK as adjunctive treatment with antimicrobial therapy compared to conventional resident protocol.
Randomized control trial.
Yes.
So put that in your objective. Your objective is to organize a randomized control trial. And this resident protocol should be also somewhere in your title. You say safety and efficacy, but if you do a randomized control trial, you say that you do a randomized control trial. You're also very ambitious. My God. My God.
From the previous study, the facts.
We are going to see that.
Okay, thank you very much. I want to present research. The patient that during having the treatment, then they have kind of chronic piece of embryo, and then they don't want to take this embryo anymore. They don't want to get pregnant anymore because they already have the babies before. And then we want what should we do with this surplus embryo? And the surplus embryo is already preserved in the liquid nitrogen. And then the ordinance of Indonesia said that after 2 years, cryopreserved in liquid nitrogen, it should, and the parents that don't want to get pregnant anymore, the embryo should be discarded. So actually, we already made kind of panel discussion last August, and then we invite bioethicists in Yogyakarta, and they said that this regulation is not effective. So then they gave kind of suggestion that the embryo should be treated more ethical with maybe for embryo donation to infertile couple or for research. It's some bioethicists said, like that, but bioethicists from with background Catholic religion, they said no, it's not so ethical if we use surplus embryo for research, because we will do harm to the embryo and the embryo will die. But most of them said that better we donate the embryo to the infertile couple. But then we want to know about how the patient or the parents of the embryo want to do with this embryo. If they want to maybe donate to the other couple, or they want to donate to the research, or they want to discard it, or what else. We want to explore it. And also, actually, this is an umbrella research. We only want to know about the health service opinion about this, because if the patient said that they want to discard it, and then the health service provider said, no, I don't want to discard it because it's conflict with my own religion, and then we have to search another one that want to do this. Thank you.
Be short in this course.
Yes.
So what do you think? Just titles and objectives. Please comment us. Yes.
I think this research is about a survey recommendation to the government to establish a regulation.
Can you repeat it in one sentence? In one
I think
long sentence. One sentence. Just one sentence.
I think this research is a survey.
Survey.
Survey to give a recommendation to the government.
To
Is
give
that
recommendation to the government.
as is to establish regulation? Is that right?
Yes, but not only in the surface like that, because we only want to take deeper, but also in deep interview with the patient or parents about their opinion. So we also want to the background reason if they choose something.
Can you say it in one sentence? Short. We scientists, like here is clear, the objectives are only part of the decision-making process. The decision-making process is much larger than only the survey you do. So, or you change your title, or you change the objectives. Do it afterwards, but the title is much broader than what you do. Think of it. The title should be exactly what is in the objectives, or the objectives should be what's in the title. Coherence between that. Absolutely. I apologize to criticize you. It's better to criticize you now than when you have to defend it, your proposal in jury, and they say, no, this is rubbish. Or worse, when you have finished your article, you send it in, and then the reviewers say, rubbish. It's not. And now we should be really severe.
Okay, thank you. In this seminars, the topic, the title we would like focus for the research is about the health promoting behavior among patients with different group of cardiovascular risk in Indonesia. The significance is actually that we have a map risk of cardiovascular from the WHO. However, the implementation is still minimal in Indonesia. And focusly in health promoting behavior, actually there are 6 domains, and one of them is the spiritual growth. As we know, Indonesia is a huge number of the Muslim. It might be different with other population. And for the another second domain is about the nutrition. For the Muslim, we only eat the halal food, undesirable food under Islamic law. Those from that background, we would like to concern on how people with the different group of cardiovascular risk, low risk, medium, and high risk, in promoting their behavior. And the objective is a screen, but in the age, we would like to explore the demographic data and cardiovascular risk in predicting health promoting behavior among patients with cardiovascular diseases. And previously only describing and correlation with the demographic data. Thank you.
Open for criticism, folks.
Number 1 and the third. Thank you for the question. The The first objective is about describing, because in Indonesia, the WHO have the different map of risk in cardiovascular diseases. However, we currently have no data about the current condition of cardiovascular risk in our country. So the first objective is we want to describe, we want to identify only presenting in univariate kind of that. But the third one is we would like to know what's the factors that could predict the health promoting behavior among the different cardiovascular risk groups. So actually it will be interesting for the high risk, but because we have no data, so we believe that it could be initial project to understand about our situation. Therefore, the further we will focus on high risk, a high group of cardiovascular risk.
Can you tell me about which health promoting behavior you focus?
Based on the health promoting model, it was established from the theoretical definition. It has six aspects or 6 domains. Spiritual growth, health responsibility, nutrition, physical activities, stress management, and what I forget, sorry. But the significant could be on the point of the spiritual growth when people in Indonesia are Muslim, that we might have different spiritual things that we need to be explored, and it might differ with the Western countries or other countries, kind of that.
So you are going to look at these six items of behavior.
So far.
So far. And because you are speaking a lot about religion, with which other demographic data are you going to explore?
From the previous research, there is evidence that say maybe we still have no data about the correlation to the spiritual growth, but in the whole aspect of the health promoting behavior, age, gender, level of education, then employment status could affect how people doing health promotion behavior.
How many of these data are you going to correlate with 6?
I tried to count it using G-Power software, and this is kind of to find the sample size using the around 9 predictors, including the cardiovascular risk. It's
9 predictors.
Yes, I need
6
yes, I need 1 full 8 participants.
Nine predictors. 6 outcomes. 800,000 people. You try to make it feasible. I try to understand what you want to do. This will be very, very different. Okay, let's see. Next. Arista.
So this is a great research. Our title is diabetes. So the little background, because the diabetes is found or common in females and also in postmenopause stage, and also based on literature review, it has a correlation with the level of estrogen receptor and progesterone receptor. So far for the diagnosis of benign and malignant thyroid, we need to use invasive biopsy examination. So we work
Okay. This is open for discussion. What is your gold standard?
For the 999, the gold standard is
What is your gold standard in your research?
histopathology findings using tyrosine, total tyrosine.
What will be, so these receptors
Yes.
are predictors of malignancy. Yeah? Ultrasound is a predictor of malignancy. Yeah? Why do you compare two predictors? What will be the use then? Would the use be that you can say, when I find this type of ultrasound, I should not look anymore at the receptors? Yeah?
Because the histopathological examination is invasive and maybe not available in many facilities.
Pathology not necessary to predict that it is malignant or not.
Yeah.
Actually, we want to correct with the MIX level expression. So, for example, for estrogen receptor, if the expression is high, it tends to be malignant. So, if the ultrasound, we want to find which ultrasound finding has high correlation with the level of estrogen receptor expression.
And why? What will be the final use of that? You should not answer now. Think of that, because that will be the reviewer will say, what, for God's sake, are you looking at? What will be the practical consequence if you find a constant correlation? Think of it. Don't answer now. Yes. But then the reviewer, they will write to you and say, hey, what is this about? What do you want? What will be the practical consequence? Think of it. Okay. No risk too.
National Infection Service, especially in primary hospital. And the objective is because of mapping, so I want to evaluate how is the service.
I think you all do not dare to criticize each other. You should now criticize each other, and then these proposals will go through. If you do not criticize in the beginning, then the reviewers will just shoot it off. What do you think? Yeah. Short, huh? One
Yes.
sentence.
Okay, correlation between title and the objective. My question.
The title is mapping, and the objective is evaluation.
The services in the primary health center since about 1-2 years ago, there is a certain service to what is like detection of STI because of the what is the prevalence of the diseases increasing, like detection for the continual discharge like the urethritis and also the genital ulcer. And actually, we also want to know about the the program of the government is already conducted by the primary health center, especially for the diagnosis and also the management of the STI disease in the population.
In most STI centers, they have a syndromic approach.
Yes,
Syndromic approach. So they don't make a diagnosis. Only syndromic approach. What are you going to evaluate exactly?
actually for the, what is the, like the
Say it in one word. What are you going to evaluate in one word?
the quality of the service.
Quality of the care.
Yeah, quality of care.
What will be the gold standard of the quality of the care?
The gold standard is there is the guide.
Guide. If they follow the guide.
Yeah.
So then put it in. Don't say we are going to evaluate. Evaluate. If you say adherence to guidelines in STI. Yes? You see, this is all about words, about simple thinking. This is kitchen. This is kitchen. What are you going to prepare? I'm going to prepare dinner. Yeah, but what are you going to prepare? I'm going to prepare potatoes. Which kind of potato? What is in it? And so on. Simple things. But be consistent, correct also. Put in it what you are going to do, really. And be, lucid in the rawat. Right, please, shout. Think you are in a hall of 1,000 people in let's say, New York.
Relationship between internally in 8 levels and nasal polyp stage in chronic rhinoceros stage. And I would like to determine relationship between 8 levels and nasal polyp stage in chronic rhinoceros stage.
Open for discussion. Of course, jump up. Ask something.
My question is, what do you mean with relationship?
One word.
I want to know about the level of PL8. I make different states of nasal polyps. The higher states is maybe the higher level, the high level, like,
You think it's predictive or it is causal? When? Prediction. Prediction. Think. And then you should. Yes? And then it is, if you think of cause or prediction, what are you going to do with that? Yeah. Because research should be useful. This level of research, clinical research, should be useful.
Try to, yeah, I will try to share our protocol. The title is Vitamin D Supplementation in Systemic Lupus Erythematosus and Juvenile. It's a randomized control trial, double-blind and placebo-controlled trial. So, yeah, only a few background. So, jump to the objective? Yes, okay. Okay, our objective to evaluate the effect of vitamin D supplementation on disease activity in juvenile onset SLE. So that's a clinical trial. Yes.
What do you mean with disease activity?
Yes, we can measure the disease activity in SLE with the some score. We call it SLEDAI. SLEDAI is systemic lupus erythematosus in disease activity. So we can measure the disease activity based on that score. So it's mean that the can we talk about hypothesis? No, okay.
Are you really going to do that? Or is
If
it
I
just-
have the funding, so it's really great that if I can do the clinical trial. But if can we see the background? So, so if but if you think or the audience think that it's not feasible to do it, so maybe I will change the topic with the correlation between vitamin D deficiency and the disease activity or the prognosis. But I stick with the vitamin D deficiency and lupus.
Very, very ambitious.
So what should I think?
Go back to that. Yeah,
Okay.
back.
Okay.
Thank you. So, I mean, it's perspective views about life-sustaining treatment decision making in pediatric critical care.
What is the first word?
Perspective views.
Perspective.
Yeah.
View.
Perspective view.
Ah.
About, yeah. The objective, the first is to calculate the cost of care in the ICU, and the second is to determine perspective view about life-sustaining treatment in pediatric critically ill among the physicians, residents, nurses, hospital managements, parents, and religion leaders.
What do you mean about perspective view? I'd like to know.
I mean, it's opinion.
Only opinion.
Opinion, yes. Because in Indonesia, many different view from the West about the culture, maybe the religion, and especially the culture in Indonesia is different.
No, I'm just thinking all the time. I'm thinking I think this might be very interesting, but no? Okay. No. ideas, yes.
May I ask about, not about the objective or title, but what's the expected outcome would be? It will be comparison or kind of that?
Yeah. At first, the outcome is how much the cost of care, its admission in PICU, its patient, and the second outcome, how the opinion about life-sustaining treatment, for example, especially withholding and withdrawing in critically ill, especially in children, because in many cases in my ward that many intervention is maybe futile, but many parents don't want to stop or to reduce the some medicine or intervention. For example, about the use of mechanical ventilator and the others.
Yes, it's a very good question. What is expected? Yes.
Maybe what I get from the presentation is for the perspective clinical decision making process.
Decision making, not
Yeah.
clinical decision. Decision making. To how about the opinion about the specifically is withholding or withdrawing in intervention in PICU, pediatric ICU. Yeah.
That's what I think. The decision making process whether between the
Yeah.
family itself,
Yes.
the decision and
Yes.
others.
Yeah.
Interesting, very difficult task. Don't know any other. But where is your...
I was going to send it because it was
Yeah, never send it now. It's not ready, send just the title because that's very interesting.
The TP, the process.
Hallelujah, send it.
This is
Her email went to your spam.
Thank you very much.
Never start speaking before there is silence. Never.
Thank you very much. I would like to show my title of the research. Is because I work at the hospital on the medical and education division. So the title is about the Dr. Sabito Hospital preparedness as a part of academic system. The objectives is to measure the Dr. Sabito Hospital preparedness in becoming a part of academic system.
Questions?
is a new system in Indonesia that is already educated from the managers, from the team, and also from the directors. But I think because the level of the staff in the hospital and maybe the faculty is not already for this system. So in this research, we would like to measure preparedness, and first the preparedness of the human resource, and then the preparedness of the facility, and maybe the system.
What is the academic health system? What is that?
Academic health system is a health system that involves education institution like the Faculty of Medicine and also some hospitals around the Faculty of Medicine. So not only in one hospital, but it will provide health services involving many hospitals around the Faculty of Medicine.
Very curious to see what you mean by all this. Curious. That's the first time I hear that academic health system.
It is already established in America because we have deficiencies, and as Faculty of Medicine, we have to educate new medical doctors, but because of our referral system, then our hospital as the third referral system, they do not have enough cases. So we try to, this is one of the methods to broaden the facility of education and also the health services, because in Indonesia the primary health services is also lack of medical staff. So being an academic health system is trying to give health services for the people and also to make a better qualification for medical education.
Yeah, I think this is really, really interesting to see how your morning staffs really train people, or they give them the opportunity to have a small breakfast, or to sleep a little bit longer. Yeah. I'm curious to see how are you going to measure that. Wow. Very interesting thing, huh? Where did you have sent?
Yes.
But then you can send it by, yours we will discuss tomorrow, or I discuss with you, so tomorrow we discuss with you. Is yours coming out or not?
We have sent it.